This is Ramesh Ramanathan. I'm a medical oncologist at the Mayo Clinic specializing in the treatment of pancreatic cancers. And today I have the pleasure of having Anita Moyer, who's a registered nurse and also the GI oncology program intake nurse. When someone, a patient or a family member is diagnosed with pancreatic cancer, the news certainly can be overwhelming. So how can someone start to get help?
They can start by contacting Mayo Clinic. As a GI oncology nurse coordinator, I contact them within the next 24 hours. I assess where they are in their diagnosis and what their needs are. I give them my personal phone number so they can call me at any time for continuous education and emotional support. I've had patients tell me that I'm their personal Mayo Clinic concierge.
Thank you, that was great. I know there are a number of ways a patient or a family member can request an appointment. What do you recommend, and is it online or telephone call?
Mayo Clinic has several different sites, and you can request an appointment online at mayoclinic.org, or you can contact the appointment office directly at the phone number below, and they'll start the process for you.
So a patient with pancreatic cancer can have many needs. It's always not clear who they should be seeing. Obviously, we want patients to have surgery if possible because that's the best modality. Right. And how do you decide? Is there a multidisciplinary clinic?
Well, the pancreatic team has gotten together and created several algorithms to help us decide what the next step will be in their care. Of course, everybody's treated as an individual. If it's unclear after speaking to the patient and reviewing their medical information, who they should see first, I do collaborate with the pancreatic team to see what should be the next step for them.
And I would think if somebody needs surgery, they would see the surgeons first, or a lot of patients present with jaundice, so they would see the gastroenterologist, so there's a lot of discussion among the team.
Right. I mean, patients come in at all different levels. Sometimes they've never even had a biopsy. They just have a mass on their CAT scan. So they usually start in the GI department first with that. If they've already had a workup and they are just looking to see a surgeon, then I would just refer them to the surgery department. If they've already been diagnosed with cancer and they know that they're not a surgical candidate, then I refer them to oncology and radiation oncology.
Yeah, thank you. That's very helpful. Here at the Mayo Clinic, we certainly have a number of patients who come from quite a distance. And what kind of assistance is available for travel and lodging?
Well, the patients are given an accommodations guide, which has an extensive list of hotels here in town. And then if they need further assistance, we do refer them to the social workers. And we do have a patient navigator through the American Cancer Society. Her name is Kathy, who will assist them with lodging and lodging and transportation as well.
We have this new role in which you are as the GI oncology program coordinator, and as physicians, we find this incredibly helpful. So what is your role when it comes to patients?
Cancer can be overwhelming, and patients have lots of questions. I'm just here as their support system to make sure those questions are answered, they get the care they need, the testing that they need, and I'm just here as a resource for them. So.
Thank you, Anita. That was very helpful. And I hope our viewers found this useful as well. And if you need further information, please contact us or visit us at the Mayo Clinic website.